Hello everybody, I'm Dr. Rajlaxmi and today I'm going to talk about the aches and pains while working from home. So as you know, during this lockdown, companies and organizations have asked their employees to continue their work from home. Although it seems a pleasant and convenient idea, it has been found that working from home has caused a number of physical, mental, and psychosomatic disorders. It is important to avoid and correct these conditions as soon as possible. So let's say what are the causes of these problems? So there is a shift of environment that is from the office environment you are going to the home environment. So as you know, many of you work from home and you have turned your dining table, your home desks, your sofas, etc. as your workstation. This shift causes pain and damage to your body because of the less ideal ergonomic environment. Also, office environment is where you can focus more on your work, you're more productive and you're more efficient. And when you're at home, you have diversions and there are various other things. So, what are the physical problems during working from home? So, there is neck pain, back pain, shoulder pain, hip pain, knee pain, head and eyes pain, right? So, I have Dr. Mayank with me. We are going to see what are the wrong postures we can do. So, if you see, if it is visible for you, his legs are dangling, his knees are not supported, his back is not supported, and he's slouching in front. He has a forward neck posture and he does not have any support for the shoulder and the elbows, right? So all these improper postures, they lead stress to your cervical spine, they lead stress to your lumbar spine, that is your lower back, they stress your eyes, and because of the neck and the stress of the eye, you further have headaches and your shoulder pains as well. You have dizziness. When you're slouching, you have a tight colon. That means your stomach and intestine are under stress. Also, when you're slouching, you're tightening your hip flexor muscles and weakening of the buttocks also takes place. The thigh muscles also are under stress, which causes your knee pain. Now let's talk about mental stress. So there is lack of structure around your house that is favorable for your working environment. So there are distractions, maybe from your family members or from the maid or something or the other. So there is so you have a difficulty in setting boundaries. So you can't tell your parents or your children that you have to stay away from me right now. You cannot say that very frankly, right? Also, there is an issue of social isolation. Um, since you're bound to your home, you're not able to interact with other people, you're not able to change the scene of the house, you're not able to go around anywhere, like going to the shopping mall or for movies or so. So, isolation also leads to depression. Also, there is stress associated with constant use of electronic devices. So, if you have your phones, laptops, mobiles, television, and all you're using for a long time, then you can also have stress. Also, your sleep pattern also changes, which again causes mental stress. Now, there is one thing called a psychosomatic pain, that is pain associated with your mental health. Psycho is mental and soma is your body. So, whenever you have stress, you can also get pain in your neck, your back, or anywhere else wherever you have the tendency of getting stress. So how do you correct all these postures? First of all, you need a very good environment. You need a proper desk, a proper chair. I don't want you all to sit on sofa or bed or anywhere where your optimum ergonomic structure is not there. All right. So I'll be demonstrating on Dr. Mayank how to correct your postures. So if you see, the chair is quite ergonomically perfect for him, but he's not using it. He's not utilizing the S-shaped curve of the chair. So you have to sit back, relax, and if possible, just relax your neck. If you're using a laptop or TV, it should be around 18 to 35 inches away from your eyesight. If you take back, if you see, his legs are dangling. This dangle should not be there. We can use a footrest or we can use a pillow over here. So this is how you can maintain a good posture. Always remember that your elbows should be placed at 90 degrees. Your hip and knee angle should also be maintained at 90 degrees. The viewing of the computer should always be around 18 to 24 inches away from the eyes, right? And your feet should always remain flat, all right? So what else can you do to avoid all these stress? We have to concentrate on the breathing pattern. We have to concentrate on the breathing exercises. So try not to sit for more than 45 minutes to 1 hour. After 1 hour or so, you can just get up, roam around, have a glass of water or something and come back. During this time, you can also concentrate on your breathing exercises. So you can go for your pranayam, you can go for pursed lip breathing, or you can go for your diaphragmatic breathing. Also, at least 5 to 6 times a day, you should always try to do stretching exercises just to relieve the stress from your body. Try to use Bluetooth devices or earphones or a speakerphone while working so that you're not constantly using your neck to go on calls or attend the calls. So let's start with the stretching exercises. Over here, we can always go for neck stretches. You stretch your neck, hold it for 10 to 20 counts and relax. Simultaneously, you do it on the other side and relax. So you can do it by yourself. Just place your hand on the side of the head. Your elbow should face your ear and then you have to pull your neck down. Hold for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10 and relax. Alright, similarly on the other side you have to do. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now always make sure that your neck is completely bent and you are not shrugging from your shoulder. Try to maintain it downwards as much as possible and then pull your neck. Right? The next one is tilt your head a little bit slightly. You say 45 degrees and then pull it down. So you can get a good stretch right above your scapula or the shoulder blade. You hold it for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. You can do it by yourself. Turn around. Keep your head straight up. Your elbow crease should face your nose, and then you have to pull your head down. Again, make sure your shoulder is not shrugging up. You have to depress it down. Hold it for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. And relax. You can do it for say 2 to 3 times in a go. Then you can just expand your chest. You hold your hands behind your neck and pull it back. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. This you can do it by yourself. You just have to search a corner of your room. So Dr. Mayank, can you please go to the corner? Place your hands on the either side of the walls. Take one step front and one step back. And try to push your wall. You'll get a good stretch on your chest. Hold it for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. And relax. You can do this by switching your legs. Hold it for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. That's it. Next is for your waist and your lower back. So you twist and turn your back. So just stand against the wall and try to touch the wall on either sides. 1, again, 2. This is a good exercise, and if you want to prolong the stretch, you can hold it for 10 counts. Hold it for 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So during this, make sure that when you're turning around, you're not twisting your hip. Your hip should be maintained and just your waist is turning around. If your back is not flexible enough, you can just hold with one hand. Try to touch the wall. No need to go all the way around. Then again on this side, if you're not able to touch, just drop this hand down and try to touch the wall. Relax. Same thing goes on the sides of your waist. Just hold your hand, just top about the hip and go down. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10 and back. So during this, you make sure your elbows are up, parallel to your ears and bend from your waist so that you're not hiking your hip up. So this is a wrong posture. Try to ground your feet down and then stretch them. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Perfect. Next is for your hands and your quads. So first we'll say for your quads. So can you come over here? Just place one hand and bend one knee. Lift your knee up and hold it with the opposite hand. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now switch side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now, next one is for your hands. You just simply have to touch the toe. So stand against the wall and try to touch your toe. Go as much as possible. If you have a history of back pain or you are having a back pain right now, so try to avoid the pain and just reach the pain and come back. Hold it and up. So these exercises are essential for you. Try to do that at least 2 or 3 times a day. Other things that you can do is establish a work zone that is in your house. You just have to select a place where you can isolate yourself and set up your table, your chair, and you have to work over there, nowhere else. Stick to a schedule, like you get up in the morning at around 8:30, then you have your breakfast, start working till from 9, get up at 10, have a glass of water, have a juice or something, and then come back. Then start working, and then same thing goes after every hour. Reward yourself. You know you have achieved something, you know you have done something, so you can award. So for me, I love chocolates, so I reward myself with chocolates. So for you, it can be a fruit or something like that. Exercise regularly. All these exercises are very, very essential for you. They'll help you in maintaining a good posture, and also they'll help you in reducing the risks of pains because of the uh, work from home environment. Focus on your hobbies. If you are interested in writing books, if you're interested in dancing, if you're interested in, say, watching TV even, try to do that once in a day. And also try to grow some plants as they bring a sense of achievement for you. Try to do that with your kids so that, for example, if you're growing a tomato, so your kid and you can say that, yeah, we have grown our own tomatoes and eating that tomato will be very sweet. So I'm open for some questions. If you have any, please do. Okay, so I have a question that what should be the position of the neck? I tend to get pain in the neck working on the laptop. Why does this happen? So as I explained, if you're not maintaining a good posture, if you're not supporting your back, it is going to come on your neck. Your spine is a single unit. So if you're not maintaining a good posture of your spine from the lumbar region, it is also going to go in your neck. So don't slouch. Try to support your lower back with the help of a pillow or something, and eventually it will get back to your neck. So your neck should not be forward. It should be well supported. If you don't have a big chair where your neck is supported, you just have to support your lower back. Yes, Mr. Jayjeet Kushwaha. His question is, how can I save my back while working on laptop? I get pain. So I just need to see what kind of environment you're working in, whether you're working on the bed or on the table. If you're working on the laptop and if it is still hurting your back, so I would recommend a uh, Bluetooth keyboard and a mouse so that you're not constantly like this. Also, try to maintain a good posture while sitting, and a supported chair will be essential for you. I would like to add whatever postures you're having right now, how you're working out, and how you're working on the laptops. I would like to know. So why don't you take pictures and post it on the page so that I come to know how you're working and I can correct them as well. So there is a question about um, hello, with pregnancy I have back pain. How can I treat it? Any precautions? And is cycling from at home safe? Yes, cycling, I think it will be safe. I don't know which trimester you're in right now. In initial stages, like if you're in the first trimester, I think cycling is um, okay for you. But make sure you're not cycling more than 10 minutes. And as I said, I need to see what all postures you're attaining right now. Also, I would recommend that you also do core exercises that will help you in reducing the back pain. So Ashish Kumar says, I have cervical spondylitis. Can I do these exercises? Of course, you can do, but you have to maintain a good posture while doing that as well. I don't want you to do. I don't want you to do excess of the movements. The side stretches and the cross stretches are really nice for your neck as they open up your spine as well. Okay, Mr. Jayajit, on the bed is a very bad option. I suggest that you sit on a table and a chair. That will be really nice for you. And that I don't know the height of your dining table. The dining table should also be in a proper height. So if the table is higher than your chest bone level, that is just below your, just above your abdomen, if the level of the table is above that, then I would suggest that you put two cushions underneath your buttocks so that you get a height and also get a leg support so that your legs are flat and you have a good elevation and your back is also supported in that. So, what should be the position of the neck? I tend to get pain in the neck working on the laptop. Why does this happen? So your neck should be in alignment. I'll show it on Dr. Mayank as well. If you can see, if he slouches, his neck is going forward. His ears are beyond his shoulder. Make sure your back is straight so that his ears are in alignment with his shoulders. Right? Also, if he goes beyond this, that is again going to hurt your lower back and eventually your neck. So it is better you sit upright. So if you can see, he does not have enough back support. So for that, what you can do is you take a pillow, stuff it behind your lower back, and then sit. So in this way, at least your lower back is supported, your neck eventually straightens up. Mr. Ashish Kumar, for cervical collar, for what? Is it hurting you that much? I, as a physiotherapist, would not recommend a cervical collar because for me, if I use a cervical collar, it's going to reduce the efficiency of your muscles. Your muscles are going to get weaker and weaker. I suggest that you exercise and take care of your cervical muscles. That will be very essential for you. Cervical collars will be only if you're traveling where you know that your neck is going to be in a lot of stress. I think that will be fine. You can use in that cases. But when you're working from home, I would suggest that you take frequent breaks, like after 45 minutes to 1 hour, you take a break. I think the stress will be lower in your neck then. So can I take some medicines and can yoga help me? Yes, you can take medications if your pain is too much. You can always go to the orthopedic doctor and he can recommend a good medication for you. And yoga, yes, you also have to take care what yoga exercises you're doing. Not all the exercises are, not all yoga asanas are good for you. Some will be good for me, but some will be, that same yoga exercise will be bad for you. So you have to take care of that as well. You always go to the expert and then get trained. Um, Second last, okay. After cervical collar, yeah. Can I bend forward and do gym workouts into weights? Okay. Um, I want to know the history of your condition, like how much pain are you having right now? Forward bending with gym weights, I don't think it is good for you. But if you're doing it in the wrong posture, of course, it is going to cause pain in your back. Right now, when you're working from home, I would suggest that unless you are a gym trainer yourself or a medical professional by yourself, I would say no, not right now. Ashish Kumar says, I do get tingling in the finger. What should I do? Um, I think you should come to me. Yeah, I think you should follow up with a physiotherapist and let them check you properly. Let's see what is happening, why the tingling is coming, and how can it be rectified. So, Sanjana Kushwa has asked for any precautions. If you have a donor pillow or if you have a lumbar pillow, I think you can use it while working from home. And yeah, for you, postural changes is essential. Like, don't sit for a long time, don't stand for a long time, and don't lie down for a long time. Um, you can change your postures after every 2 hours. It is essential for you. Um, okay, how can I? Okay. So, can you tell me which trimester you are in? Like, what month you are in right now? So, if you're getting pain during while working and making food, I recommend you take ice packs for your back and whatever instructions your gynecologist has given. I think it is essential for you. If she has recommended that you're not supposed to stand for a long time, I think you should follow that. Again, I need the history so that I can give you proper answers for that. Any precautions for my neck? Yes. Work, exercise properly, maintain a good posture, stretch your necks, stretch your neck, and yeah, don't try to shrug your shoulders too much. So if you're working and if you're stressed out, you tend to shrug your shoulders. Again, it is going to put in pressure on your neck, which is again wrong. So try to maintain a good posture. Your shoulders should be dropped down and take frequent breaks from your work, like after 45 minutes to 1 hour. I think that is essential for you. Okay. If you're not even able to stand and doctor has recommended rest, then I think you can sit down whenever possible. Like for chopping your vegetables, you can just sit down and chop your vegetables, and you can just put on. You can put the veg. For example, you want to do sabzi, so you just put on the vegetables and then again sit back. You don't need to stand there constantly and for a prolonged time. You can take breaks again and again. I think it will take like 10 minutes. If you're having pain after 10 minutes, then I would recommend that you take break for a while. I won't suggest to for you to keep standing for that long as well. So few gynecologists say that hot fermentation is bad for you. Few gynecologists say that the ice pack is good for you, and few say that ice pack is not good for you. So whatever your gyno has said, I think you should follow that. Yeah, you can go for Voron or any other ointment. Go for a mild ointment. I think that will be okay for you. A mild massage will be okay for you. Very mild, gentle massage. I think that will be okay for you. All the viewers and all the people who will be seeing this video, I would, if you have any queries, you can definitely send me a message, and I would be happy if you send me photographs of your workstation and also the posture you're attaining. Make sure that you take photographs when you are not aware of the other person taking your picture. Exercises, I think twice a day is good for you. Thrice or twice a day. If they are good exercises, the easy exercises, you can do twice a day or thrice a day. But make sure they are not causing any pain. The pain will be reduced for sure. You can always. If you work, so cervical spondylitis is a thing where the condition doesn't go away as such, but yeah, you won't feel pain. You can lead a normal life. There are many people who have cervical spondylitis, but they don't have any pain or such because their muscles are strong enough to hold the spine. So I think for you, a curable term is different. For us, a curable term is different. If you're holding the exercises, so the best thing is 10 repetitions and 10 count hold for each exercise. If you're stretching, then 20 count hold will be good. Also, you can use hot pack. That will help you in reducing the pain. So thrice a day hot pack, I think that will be good for you. Ashish Kumar, I would also suggest that you use wireless phones and wireless Bluetooth devices so that you're not constantly, like, for example, you're using a phone, you're always like this, it is going to hurt your neck. So use um, at least Bluetooth or earphones or something like that. So spanning. Okay, so what all do you do every day? Like, what's your schedule like? Do you always are like this all the time? You're on the computer, or what do you do? I need to know that. So if you're using laptop and you're constantly like this, then I would recommend that you elongate your back and keep your hands down, and then so that your shoulders are dropped down and they're not causing pain. Okay. So cramping can be because of a lot of reasons. If you're not stretching, then it is going to cause you pain. If you're not doing your exercises, it's going to cause pain. If you're not well hydrated, then again you're not. If then again you're going to have pain. So I need to know details about why you're cramping. You're most welcome, Mr. Jayajit. Yeah, I'll be looking forward for such sessions as well. Cramping usually is if you're not, we'll surely do that, sir. Thank you so much. We'll surely take care of that again. We can go for cervical as well. We can go for back. We can use this as separate topics also. So just suggest whatever you want to focus upon. We can put on that as well. Cramping, as I said, it can be because if you are low in vitamins, especially K, and if you are not hydrated properly, and if you are working all the time, you're working out, and you're not stretching, so it can be because of that. So for cramps, I would say stretching, then your exercises as well, and be hydrated, have at least 3 liters of water per day, and of course banana is a good source of vitamin K, so you should always have that. Also check if your sodium potassium level is um, proper or not. There is also one thing, the new studies have showed that if your magnesium level is also low, it can cause you cramping. So please check whether all the vitamins and your magnesium and salt level in your body is proper or no. Even if you have magnesium, then I think the cramping will also reduce. I think that's it for today. I'll please comment on the comment section where all the questions that you have, all the queries you have, and any suggestions that you would like to know, uh, and I'll get back to you then. Thank you.